Okay, I'm going to hop on a soapbox for just a couple of minutes and tell you why I, a physician, do not have health insurance.
Most important thing, he says he's a physician. You remember that when he explains this to you.
In the traditional sense for my family this year. Last year was frustrating enough. $1,750 a month for my family of 5.
Not bad. I've paid $1,400 for 2.
Cheapest plan available on the healthcare exchange. Just wanting truly catastrophic coverage, HSA eligible.
Which is what I suggest, by the way. Catastrophic coverage, or the idea that worst case scenario, if you have cancer, you can get chemotherapy treatments. Those are the types of things that I look for most people.
With a $4,000 deductible for an individual, $8,000 for family, and probably a copay after that for a high out-of-pocket max. So we were spending over $20,000 a year, and unless something bad happened, we're getting really nothing.
Well, what you're paying for is insurance in case something really bad does happen, which is what the physician doesn't tell you, because for the most part, he can call his friends and get advice. Just remember that as well.
Preventative care visits for my kids. But my wife and I pay cash to wellness physicians. And so really, we're not getting much. It was there just for emergencies.
Also, he's a physician. So kids get sick, right? Go see dad. He's downstairs playing 2K, whatever dad does, right? When they say these things, doctors keep saying they're no longer getting insurance. It's not practical for the average person. And I just want to walk you through what I mean by that.
Well, this year it went up another $200, close to $2,000 a month. And I just couldn't stomach it. Paying $24,000 a year, and then having to pay $4,000 or $5,000 more to hit a deductible before there was any true benefit. That's insane. And I won't go down the rabbit hole of what I've seen in my private practice in terms of markups and lab costs.
No, he won't go down that rabbit hole because it's a rabbit hole, right? For one. For two, it would expose a lot of different people, right? And as someone who's been in the healthcare business for years, I can tell you a lot of these codes that are used, and even when we get mad at insurance companies, a part of me understands it, right? A lot of people have taken advantage of the program. Now, on the other side, they should still do whatever they can for people. I'm not saying that, but I will say that I do believe a lot of clinicians have taken advantage of the program.